Hey everyone, Alex Rains here, and for my policy brief this semester, I took a look at housing first policy, as well as the connection between homelessness and addiction. Now, a lot of people these days are saying that homelessness is the major social crisis of our time. There's no state in the union currently that offers a minimum wage that will afford you a one-bedroom apartment. Full stop. Also, and this was interesting to me, it has been shown that there is a strong connection between homelessness and addiction, but not the one that most people think. Finally, housing first policy in regards to homelessness and addiction combined has achieved a lot of successes right here in the Pacific Northwest, both in Portland and up in the Seattle area. And that's success defined not just by personal outcomes, but by social and economic ones as well. So yeah, no, that's important, that economic aspect, because having chronically homeless drug addicts on the street actually costs a lot of money, whether it's jail bookings, keeping people incarcerated, shelters, sobering centers, hospital visits, emergency room visits, publicly funded alcohol and drug detoxification and treatment clinics, emergency medical services, and so on. Whereas there's actually a number of studies at this point that have found that it costs less in terms of services to simply put someone in an apartment and pay for it. So first and foremost, everyone is being affected by this. Portlanders have ranked shelter for people who are homeless the second most urgent issue that elected leaders should do something about, followed only by the cost of housing. Simultaneously, there are a lot of issues right now in the Portland camps, including fires, stabbings, shootings, business leaders complaining. Everywhere I go, I hear people talk about the homeless situation here in Portland, but without ever really offering real solutions. A 2017 study identified over 500,000 homeless people across the United States, with that population rising each year, and that addiction is in fact often the result of homelessness and not the other way around. Nevertheless, National Coalition for the Homeless found that 38% of homeless people are alcohol dependent and 26% are dependent on other harmful chemicals, about 1 in 4. And that's just, a basic average. Additionally, America's prisons and jails are overcrowded with addicts, not my words, where terrible living conditions and human rights violations are seemingly commonplace. In addition to reducing the number of average days in jail, addicts who receive housing first services also typically visit the emergency department less and have less total hospital inpatient days when compared to drug users still living on the streets. Homelessness is caused by a severe shortage of affordable housing. Economists at this point have proved that housing affordability is the key predictive factor in regards to the severity of a given homeless situation. Yet despite this, homelessness and addiction have both traditionally been addressed here in the United States through criminalization. A third of American cities have laws prohibiting public camping. 1 out of 4 have made begging illegal, and almost half have outlawed sleeping in cars. Now, here in Portland, we've legalized public camping, but this has led to a whole host of other issues, including sanitation, trash disposal, public outbursts, and of course, altercations with law enforcement. Addiction, meanwhile, is criminalized separately from homelessness. And this has led to skyrocketing jail populations driven by the nation's drug crisis. Rural areas have been hit especially hard, as they typically have less resources in general to be funneled into chemical dependency treatment and healthcare centers. And they end up with a lockup rate of more than double that of urban areas. The lack of treatment options, medical treatment and addiction treatment options, directly result in low-level drug offenders being much more likely to be jailed in rural areas than to be enrolled in inpatient detoxification programs. Meanwhile, community-based treatment programs like Alcoholics Anonymous may provide a sense of community, but unfortunately, as we learned this semester, have no proof that they work any better than other approaches, including no treatment, with multiple research studies finding no significant relationship between AA attendance and outcomes. So what then are the current best practices? Well, that's where Housing First comes in. Housing First in Salt Lake City, Utah has been credited with a 74% drop in homelessness. The whole point is that it's a low barrier approach which removes requirements for treatment and abstinence. And when you do that, shows significant reductions in the use of emergency services, hospitalization, and other high-cost settings such as detoxification, sobering services, and jail. Typically, they consist of three parts. There's rental subsidies, there's dedicated communities with on-site staff or single-site housing, and community integrated housing or scattered sites. These types of places are one of the only models that work for certain types of people, and that's both according to the data and to the people themselves. And in general, Housing First sites are associated with reduced publicly funded service utilization and associated costs, decreased alcohol use, and increased housing retention. In other words, in our terrible market-driven society, the argument can be made that in certain situations, Housing First policy pays for itself and indeed can save our society money. Which is, good, not bad considering. But I also do want to say that it's worth thinking about the fact that this is all entirely arbitrary. Many cultures view housing completely differently. Capitalism causes American society to put a price on everything, from the cost of a painting to a sunset to a human life. And, perhaps out there exists some parallel universe where American housing is provided to everyone and we just simply all make less money. And maybe at this point we should all be asking ourselves if this might actually be better than the existence in which we are currently living. And if so, then maybe it's worth creating. Thanks.